The normal absolute eosinophil count is option A 0.022 to 0.5 into 10 raised to 9 per liter, option B 1 to 3 into 10 raised to 9 per liter, option C 2 to 7 into 10 raised to 9 per liter, option D 2 to 7 into 10 raised to 9 per liter. And the answer is option A 0.02 to 0.5 into 10 raised to 9 liter. Thrombocytopenia is associated with option A ALL, option B ITP, option C DIC, option D all of the above. And the answer is option D all of the above. The average size of thrombocyte is option A 1/3 of a normal RBC, option B 1/3 of a normal monocyte, option C 3 times of a normal RBC, option D same as that of normal RBC. And the answer is option A 1/3 of a normal RBC. Which of the following is associated with bleeding disorders? Option A decreased RBC count, option B decreased neutrophil count, option C decreased platelet count, option D increased platelet count. And the answer is option C decreased platelet count. Osmotic fragility of red cells in case of hereditary spherocytosis. Option A 6 to 7 gram per liter of sodium chloride. Option B 4 to 5 gram per liter of sodium chloride. Option C 3 to 5 gram per liter of sodium chloride. Option D 3 to 4.5 gram per liter of sodium chloride. And the answer is option A 6 to 7 gram per liter of sodium chloride. RBC count is increased in the following conditions except option A high altitude, option B pregnancy, option C newborn, option D dehydration. And the answer is option B pregnancy. High hematocrit value is observed in the following conditions except option A pregnancy, option B diarrhea, option C dengue fever, option D polycythemia vera. And the answer is option A pregnancy. A sample of blood is collected in a clinical laboratory. Which among the following tests should be performed first? Option A PCV, option B HB estimation, option C blood grouping, option D ESR. And the answer is option D ESR. Buffy coat smears can be used for the demonstration of the following except option A malarial parasite, option B megaloblast, option C LE cell, option D microfilaria. And the answer is option D microfilaria. The best routine method that can be used for hemoglobin estimation is option A Sally's method, option B oxyhemoglobin method, option C chemical method, option D cyanameth hemoglobin method. And the answer is option D cyanameth hemoglobin method. HbF differs from HbA by its following properties. Option A its resistance to alkali denaturation, option B its resistance to acid elution, option C its higher oxygen affinity, option D all of the above. And the answer is option D all of the above. Relative electrophoretic mobility of HbS at pH 8.5 is option A HbC, HbS, HbA, HbF, option B HbS, HbC, HbE, HbA, option C HbC, HbS, HbF and HbA, option D HbA, HbF, HbC, HbS. And the answer is option A HbC, HbS, HbA, HbF. The reagent used for solubility test for HbS contain option A sodium metabisulfite, option B sodium disulfite, option C sodium dithionate, option D sodium dithionate. And the answer is option C sodium dithionate. All Rh antibodies are seen in option A all Rh negative individuals, option B Rh positive individuals, option C Rh negative individuals after Rh positive blood transfusion, option D both A and C. And the answer is option C Rh negative individuals after Rh positive blood transfusion. The speed and time for which the Winthrop's tube should be centrifuged for PCV estimation. Option A 3000 rpm to 30 minutes. Option B 5000 RBC for 30 minutes. Option C 3000 rpm for 45 minutes. Option D 5000 rpm for 45 minutes. And the answer is option A 3000 rpm for 30 minutes. Winthrop's tube can be used for all except option A PCV, option B ESR, option C LE cell, option D HB. And the answer is option D HB. Drumstick appendage is found in option A RBC, option B monocyte, option C lymphocyte, option D neutrophil. And the answer is option D neutrophil. Drapkin solution contains following except option A potassium dihydrogen phosphate, option B dipotassium hydrogen phosphate, option C potassium ferricyanide, option D potassium cyanide. And the answer is option B dipotassium hydrogen phosphate. Which among the following principles can be used for the estimation of HbF? Option A conversion of Hb to cyan-methemoglobin, option B conversion of Hb to acid hematine, option C conversion of Hb to alkaline hematine, option D conversion of Hb to oxyhemoglobin. And the answer is option C conversion of Hb to alkaline hematine.